Hi all. Today we are going to see about behavioral assessment. Okay, what is behavioral assessment? Yes, behavioral assessment is used to identify response deficit and response excess. Okay, behavioral assessment is nothing but it's mainly used for an individual to assess how they are behaving in a particular situation. Okay, it can be of any difficult situation or it can be of anything. Okay, it focuses what the person actually does, how often the behavior occurs, in what situation the behavior appears. Okay, in a particular situation how the individual is behaving. Okay, that matters here, in which situation, like how they are behaving in each and every situation. Okay, difficult situation. Okay, it is based on the idea that behavior is learned and can be changed. Okay, yes, behavior is learned. It can be learned from our parents, friends, peers, or it can be of anything, and at the same time it can be changed. Okay, so psychologists observe behavioral directly instead of depending only on interviews or tests. For example, if you are going to assess the behavior of an individual, we will not give any questionnaires, any set of surveys or not like that. We'll be doing some non-verbal tests. Okay, like it can be of interviews or by direct observation, or it can be of anything. Okay, yes, the next is methods used in behavioral observation. What are the methods that we are using? Okay, the psychologists watch direct observation. That is, the experimental will directly observe the subject. Okay, with their knowledge. Okay, the psychologist watches the person. It can be in the natural settings like classroom, playground, home, or it can be in the workplace. Okay, or in controlled or structured settings. Okay, for example, if a teacher is taking a class, he or she will observe the whole class, right? So observing a child in the classroom, watching how often a child flights, cries or disobeys. Okay, next, the information from parents and teacher. The psychologist will gain information, gather information from the parents and the teacher, or from the or the surroundings of that particular person. Okay, behavioral observation assessment often includes teacher supports, school records. Okay. Example, a boy is not doing well in school and behaves badly. Okay, how the data will be collected? Information is collected about how that particular boy is behaving in the class. Okay, his behavior at home, his relationship with the friends, and his intellectual abilities. These helps to identify the exact nature of the problem of that individual. Okay, so we'll collect the data from their surroundings like parents, teachers, family members, friends. Okay, and peers. Okay, the next is what are the need for appropriate type of behavioral observation. Okay, the clinician must decide which type of information is needed in this case. For example, in different case, the clinician will have different situations, so that the psychologist should decide which subject, like which knowledge they need, which information they need, because some behavior appears in only certain places. Some kids or some peoples will behave according to that situation, so it differs, right? So that's what they are telling. Some are seen only with certain people. Some if a person is behaving badly, they will be sometimes some individual will do behave badly in the public, or it can be or within the particular or certain peoples. Okay, that's what they are telling. Object for behavioral observation. What are the object we can use for the behavioral observations? These focus on not on personal opinions. Example of what is recorded: how many times a children hits another child. Okay, how long a child can be seated in a same place. Okay, how often a child talks of turn. Use counts, duration, and frequency. So we can count how many time the child hit the another child, and how many duration the child is sitting in the same place, and how many times he or she is trying to do something. Okay, can be recorded with checklists, or can be using the rating forms. We have a checklist for behavioral, okay, assessment. Yes, the next is Use of baseline assessment. What is the baseline measurement? The number of example, the number of aggressive responses may be a child made by a child is compared with the number of that is typical for a children of the same age and sex. Okay, it will be compared with the other children in the same age. Okay, this gives a baseline. Okay, the child's behavior before the treatment and after the treatment. Okay, after behavior modification techniques are used, the child is observed again. Once the child is get out from the that treatment, they will be again observed. The new behavior is compared with the baseline. Yes, the new behavior is compared like before the treatment how they behaved and now how they are behaving. Okay, this shows whether the treatment is effective. Yes, like using some scales or behavior checklists, we can observe this before and after their therapies or any assessments. Okay, what is the purpose of a baseline comparison? Judge the effectiveness of behavior modification, whether it will help us to identify whether the therapy is worked or not. Okay, see whether improvement has really occurred. Yes, if once the child or the individual taken the therapy, is there any changes there? Okay, all these will be noted using the baseline measurement. Yes, thank you.